ever seen a kid with a tube down their nose or a tube in their stomach? These tubes are called feeding tubes, and they provide many benefits to children who cannot or will not eat orally. Gastronomy tubes can be easily cared for by caregivers anywhere, whether it be at the grocery store or at home. My 5-year-old daughter has a G-tube. She has had her tube for going on 3 years now. She got it mainly for not wanting to eat or take medicine, which landed us in the hospital a few times due to dehydration. So during my speech, I will inform my audience of when it's time to change a G-tube, how to change a G-tube, and the functionality of G-tubes. So a gastronomy tube is just a tube that's placed in the stomach, it's in the abdomen, and they pull the stomach up to the surface behind the skin, and a balloon is blown up by water and it holds it there. So ways that you know when it's time to change a G-tube would be if it gets clogged. Sometimes parents who feed real food or a very thick medication, it will clog the tube. And you can actually use Coca-Cola to unclog a tube. The acid eats through the clog, and usually that will work. Other times you can take a syringe, pull back on it and let it go, pull back, and the pressure will kind of dislodge the clog depending on what is clogged. So you also change a tube every 2 to 3 months. It's usually dependent upon your doctor, what they recommend. My daughter's doctor recommends really whenever it stops working or a size needs to be changed. We don't have like a specific time, but insurance usually will only pay for a tube every 2 months or even a tube every 6 months. So some are not as lucky as others. So Nationwide Children's Hospital says that G-tubes, the first G-tubes change should be scheduled 2 to 3 months after surgery. And if you happen to need a change before the 8-week mark post-surgery, then that actually has to be done at the hospital, which is not usually done. We can usually do it at home or wherever we're at. But the science to that is because the stomach is so fresh and moved that if it pops or comes out, that the stomach can drop from the surface. So they like to go in, through X-ray and make sure that it's, back in its place and that everything's fine. So the next thing is when the tube is, the functionality of it is compromised, whether that be leaks. Sometimes it will leak around the side or even leak out of the button. Or it won't flush. A flush